Well, here to talk more about remote learning's impact on the mental health of students and parents is Dr. Jessica Gold. She is an assistant psychiatry professor at the Washington University School of Medicine in St. Louis and works as a staff psychiatrist at Habif Health and Wellness Center. So, Dr. Gold, thank you so much for being with us tonight.
Thank you so much for having me.
So first, I'm assuming you probably see mostly college students working at Washington University. So kind of talk about what are some of the most common feelings that people are dealing with during this pandemic for both college students and maybe their parents as well.
Yeah, I mean, college students have faced a big disruption in their schedule. A lot of them have been online or seeing hybrid, and some of them have just stayed at home. And I think they get a lot of their socialization being in college, a lot of their identity development being in college, and it's a big, big change. So a lot of anxiety, a lot of depression, a lot of just like, can I get out of this? And when is this going to be different? And you don't have the answers. And it's really hard. And I think as parents, they're really worried and they don't know what to tell their kids. And when I see parents or talk to parents, they're just like, can you tell me what to tell children? And I just tell them to listen to their kids and be there for their kids and support them as much as they can.
Well, Dr. Gold, that really just reiterates, because we know that parents, of younger children really do have concerns about those possible negative long-term effects of closed schools, distance learning, again, for the young kids, but there are also those concerns for, children or older, young adults transitioning into adulthood that normally comes with going away to college.
I think people forget a lot about college kids, honestly. If you look at the data, the CDC data it was even just like June, they had some of the highest suicidal ideation of any group. They're the highest loneliness of any group, some of the highest stress of any group of the American Psychological Association survey. And people think that they're really doing well because they're transitioning to college and it's a really fun time and they get to meet new friends. And there are a lot of new things that feel really good to people, but it's also a really big time of transition and stress and a really big time of depression and anxiety, and where a lot of schizophrenia comes out at that age, bipolar disorder comes out at that age. There's a lot of experimentation with substance use at that age. So there are a lot of things that existed before COVID, and then you put COVID on top of it, and so it is a really challenging age group.
And you just said, a lot of times that college age is maybe forgotten. And I think people just think, oh, they're resilient, they'll get through this. But you mentioned suicidal ideations, depression. Kind of how are you helping these students to cope with this? Because I can't even really say a new normal, because this will be the only thing that they've known if they're freshmen, if they came into this.
Yeah, I mean, I feel so bad for their freshmen because their high school was also the beginning, the end of COVID started when they were in high school. So I think that's a really, really hard year. And I really honestly wouldn't wish that on anyone. It's a lot of listening and supporting and doing the best I can to be there with them and tell them that, this is not going to be forever, and that this is hopefully not going to be what their college experience is like for the long haul, and to pick activities that support them, find coping skills that work, find a couple friends that can be there, find ways to check in with them. I think they're really used to texting people and not seeing people in person. They're really used to not making plans and just stumbling on them. And it's a lot of encouraging them to, make video chats, like make social plans that maybe they wouldn't have made otherwise, really make an effort to do things like that when that isn't really what they would have wanted to do.
All right, and definitely to reach out, not be embarrassed if they think they need some help. Well, Dr. Jessica Gold from Washington University in St. Louis, thank you so much for joining us tonight.
Thank you so much for having me.